Hey guys, Dr. Stephanie here, and if you've ever had a pain that goes from your back, kind of down the back of your leg, maybe all the way to your foot, or maybe some numbness and tingling, that's known as sciatica. And sciatica is actually a symptom, not a diagnosis. You may have heard it diagnosed before, maybe you've had it, maybe a friend has had it, but it's a symptom because it can be caused by a number of different things. It can be caused by the piriformis muscle, which is kind of a small flat muscle deep in your butt, and the sciatic nerve runs either right next to it or through that, and a lot of times if that muscle gets irritated or tight, that can push on that sciatic nerve, causing those symptoms down the back of your leg. It can also be caused by things going on in your spine, sometimes spinal stenosis, where there's just kind of a narrowing of the spinal canal. Arthritis, it can be caused by a bulging disc, where one of those discs that's between your vertebrae kind of gets compressed and pushes kind of out the back or out the side of your spine, and that pushes into a nerve, which causes those symptoms down the back of your leg. But whatever it's caused by, we can do some exercises to help get rid of that pain down the back of your leg, that numbness and tingling, by doing some movement and some exercises to strengthen your core and your hips. So I'm going to go through 5 exercises today that if you're experiencing this, these are a good set of exercises that you can use to reduce those symptoms and start building some strength so you can hopefully get rid of that sciatica for good. Okay, we're going to start by lying on our back. And you can lie on your back on the floor like me, or you can lie on a bed or a couch. This first one is kind of a symptom relief one. So especially if you're really experiencing a lot of pain or a lot of numbness and tingling down the back of your leg, this one can really help. So this is called a nerve glide. What you're going to do is bend your knee like this, grab your hands behind your thigh, and you're just going to extend your foot up towards the ceiling as far as you can comfortably, and then come back down slowly. So it's just going to be up and down. And this just kind of allows that nerve to glide within the path it's going down your leg, because you know it goes through muscles down here, it goes through the back of your knee. And so just straightening your knee and bending your knee, it's just kind of getting that nerve to move like it should, because sometimes it gets stuck, especially if it's irritated, it kind of gets stuck along its path. So we want it to move. Nerves like movement. So it's just up and down, and you don't want a sharp pain with this. You don't want to increase symptoms. So if you get to a certain point, like maybe here, and it causes a little extra pain, you can just stop there and come back down. And you just want to do this 10 or 15 times. And just do this on the side that's bothering you. So usually with sciatica, only one side bothers you, so it's not necessary to do it on both sides. So you're just going up and down, just like this, just as high as you can comfortably, and then back down. And I haven't counted these, but usually about 10 or 15 times is good. Or if you get to a point where it kind of gets fatigued, or maybe the pain starts to increase a little bit, then you want to back off. Okay, so after that, we're going to stay lying on our back, and we're going to do what's called a heel tap. So bend both knees like this, and you want to keep your back flat on the ground throughout this movement. Kind of engage your core, so pull that belly button kind of in and up, so kind of like very slightly in and up, and you just want to tap one heel to the ground and then back up. So alternate tapping and tapping and keeping that back flat on the ground. And we're going to do this together. So just tap and then back up, tap and back up. Tap and up, tap and up. Making sure to keep that low back on the ground if you can. And one more. And last one. Okay, so you can increase that number. I think we did about 8 on each side. But start with a low number. As you build up strength, you can increase that amount, but you really want to focus on keeping that low back on the ground. This is really working on strengthening your core muscles, a little bit of hip muscles as well. Okay, for the next one, we're going to stay lying on our back, but we're going to grab a little loop resistance band here. Place that around your feet and then lie back down. And so from here, we're going to just pull one knee up towards our head or chest and then back down, keeping everything on the ground except for your leg, and then back down. And you want to do it nice and slow. So this one's working on some core strength, but also some hip flexor strength. So you can just do this with me as well. Just up and slowly back down. You don't want that band to pull you back down. Just pull up and then back down slowly. Up, back down slowly. So we're just alternating. And you can actually start without a band if you don't have a band, or if you're experiencing a lot of symptoms or you're just not quite strong enough to use the band yet. Just go ahead and do this with no band at first. Okay, we'll do a couple more. All right, last one on each side. Okay, so now we're gonna come up and get rid of this band. Now we're gonna go ahead and go on our hands and knees. And for this position, you wanna keep this back flat if you can. And we're just gonna do what's called a bird dog. So what you're gonna do is lift one arm and the opposite leg, come back down, and then switch sides and come back down. So this side and back down, this side and back down. I'm just gonna alternate, trying to keep that back flat. I like to tell people, pretend there's a glass of water on your back, kind of right in the center there. And you don't want it to fall. You don't want it to spill. So keep that glass of water there and really do this nice and slow. Because I know a lot of times I give out this exercise and people are like, oh, you know, that's too easy for me. And it may not be easy for everyone. But if you do it very slow, very controlled, it shouldn't be easy for anyone. Unless maybe you've done this every day for, you know, a long period of time. And then you can advance the exercise. But if this exercise is done properly, then you're really engaging those core muscles, those hip muscles, even the arm muscles. So go back and forth a few more times. Just really trying to keep that back flat. Keep that glass of water from spilling. Okay, one more time on each side. All right, the last exercise is going to be a little bit of a progression. So we're going to make it a little more challenging and challenge that those core muscles. So stay in this position here. We'll go from here into a high plank, like this, trying to keep your back flat, and then coming back down here. So we're not staying in that plank position long. We're just going here, and you can do this with me, and then back down. So up and down, up and down. And this is a good way, if you find a plank hard to do, this is a good way to start because you're not having to hold that plank for too long, but you're still working those core muscles. So up and down. Do 3 more here. 2. And last one. Okay. So all of those muscles will help build some core strength, improve some mobility, and really help reduce those symptoms of that sciatica. So it's important to be consistent too. So one time doing those may make it feel a little better, definitely. But I would do these at least 3 times a week and then just be consistent and you can progress them as you go along.